I'm Tara. I'm going to be your teacher. I'm just going to do a quick head turn assessment. It's going to be about 10 minutes, all right? All right. I'll go ahead and wash my hands. All right. Can you tell me your full name?
Catherine Alice Chavez,
All right. What's your date of birth?
4/4/1980.
Perfect. And can you tell me who the president is right now?
Barack Obama.
Okay. What year and month is it?
It's September 21st of 2015.
Perfect. Okay. So I'm first just going to note her general appearance. She has light skin and freckles. No bruising or abrasions that I can see. I'm just going to go ahead and feel her scalp. Okay. And there's no tenderness there. I'm just going to feel her hands. Not skinny or tender. Now look inside the ears to see any damage. There's none. The nares, breathing. And can you go ahead and open your mouth and go, ah. Good. And then cough. And swallow. Good. And doing all these things are just testing her vagus and her hypoglossal nerve, and they are intact. So while I have the pen light, I'm going to test your eyes. So if you could just look forward, I'm going to shine this light here. Okay, good. And then look at this pen light, and then look up at the ceiling, and look back at the pen light. Good. And then without moving your head, follow the pen light. Good. So doing all of these shows that her pupils are equal, round, reactive to light, and accommodation. Okay, so I'm going to go ahead and have you sit up. Sorry. Okay. And then I'm just going to test her skin turgor. There's no tinting. Go ahead and stand up. And turn towards me and just bend down like that. Good. And then come back up. And then go ahead and walk this way just a couple of steps and then walk back. Alright, I'm noting her gait and her posture. She has a steady gait, straight posture. Okay, so now we're going to do reflexes. So go ahead and put your arms up like this. And we are going to extend and flex. Extend and flex. Okay, we're going to do the same with the legs. So you're going to extend, flex, extend, flex, extend, flex. Okay, now we're going to do range of motion with our arms first. So we're going to abduct our arms, then adduct. Abduct our leg, adduct, abduct, and adduct. Good. And then go ahead and just like roll around your foot. Okay, the other one. And your hands. Good. Okay, so you can go ahead and sit back down. And now I'm going to listen to your heart sounds first. Okay, so first I'm going to go on the right second intercostal space to listen to the aortic. And then the second intercostal space on the left is Erb's point. The third intercostal space on the left is Erb's point. The left base of the sternum is the tricuspid belt. And then the The fifth intercostal space on the left midclavicular line is the mitral valve. And I'm going to listen for a full minute here. And I determined that her heart rate is 65 a minute. And then I'm going to listen to S1 up at the top of the heart, and S2 at the base of the heart. And I'm going to listen with the bell of my stethoscopes in those same spots. The aortic, pulmonic, Erb's point, tricuspid, and mitral. And I'm going to go ahead and test your pulses. I'm just going to palpate them. So first her radial, and then her brachial, and then her posterior tibialis, and then her dorsalis pedis. And they're all, I rate them a 2+. And then you can go ahead and feel her carotid one at a time. Okay. And I'm just going to test her capillary refill. And it's less than 3 seconds, so that means she has adequate perfusion to her fingertips. So now I'm going to listen to her lung sounds. And can you take a deep breath for me? And I'm going to listen to the duck. So I'm going to have you just, For the camera purposes, I'm having her sit like this. With a regular patient, I would not have her sit on the bed like that for safety reasons. Take a deep breath in. So I'm noting that her lung sounds are clear, and she does not have any labored breathing. She seems comfortable when she's breathing, and she's able to take deep breaths for me. Okay, so now I'm going to go ahead and just have you lie down. And I'm going to check for any pretibial edema. And she doesn't have any, so I would rate that 0. And I'm going to test a couple more reflexes. I'm going to have her push against my hands and then pull. Good. And all of her strength testing I did, I rate her a 5 out of 5. And they were equal on both sides. Okay, so I'm going to go ahead and first I'm looking at her abdomen, and I note that it's flat. I'm going to listen to it first. So I'm going to listen to the left upper quadrant first. I'm going to listen for about 30 seconds. Move over to the right upper quadrant. Okay, and then the right lower quadrant. And then the left lower quadrant. Okay, and her vowel sounds are normal active. If I didn't hear a vowel sound in a quadrant, I would listen for a full 5 minutes before I said there were no vowel sounds. And now I'm just going to percuss. And I hear the normal resonance that you should. So now I'm going to palpate the abdomen. And I'm noting any guarding that she gives me for any tenderness. Does that hurt anywhere? Okay, good. And her abdomen is soft. There's no distension, and it doesn't hurt her. So, so I have one last thing. I'm just going to test your sensations. So I have this pen, and I'm going to use this side and the pointy side, and you just tell me if you feel sharp or dull. Okay?
Dull.
Good. Sharp. Good. And I have her eyes closed so that she cannot see.
Dull.
Sharp. Perfect. All right. Well, this is the end of my assessment. First, I'm going to give you the call light. Thank you. So you need to call me if you need anything. I'm going to put both of the side rails up for safety, and then I'm going to put some non-skid socks on you.
Thank you.
All right. Thanks.
Thank you.
Okay.